Thank you for joining us at VX Live. And Dr. Graham, thank you so much for your keynote. My name is Dr. Hon Pak, Chief Medical Officer of Samsung Electronics America. For the next 15 to 20 minutes, I'll share my perspectives on the megatrends and the problems we face, what Samsung is doing in healthcare today and planning for tomorrow, how we plan to innovate to the future, and lastly, and most importantly, why we do what we do. I would like to begin by sharing 3 megatrends in health that I think are important: consumerization, systems biology, and lastly, the ongoing digital revolution. First, consumerization, as you know, in healthcare is now here, and consumers are seeking care that's convenient, consumer-centered, and low cost and quality, regardless of where they are. In response to this demand, we're seeing disruptions in various areas, but especially in retail, where there's a convergence of brick and mortar with digital services. For example, Walgreens Find Care and CVS Hub Care, along with their primary care partnerships with MinuteClinic or VillageMD, are examples of this convergence of digital health and traditional brick and mortar care. Our second megatrend, systems biology and medicine, take a more holistic but quantified approaches to the challenge of biological complexity. Systems medicine uses high-throughput technology such as DNA and RNA sequencing to produce large data sets. These enormous amounts of data obtained by tracking multiple biological networks are then integrated to create a network of networks and to yield a comprehensive understanding of human biology. What does this practically mean? With this information, we can begin to understand how an individual's genetic makeup and the environment together produce health and disease. The third trend is the digital revolution, also known as the third industrial revolution, which we have been in since the 1980s, which began with the internet. This period refers to the sweeping changes brought about by mobile devices, social networking, big data, cloud computing, and we're clearly in the midst of further changes with 5G, AI, and robotics. This digital revolution has powered systems biology and consumerization and is radically transforming what healthcare is and how it's delivered. This revolution, however, has created silos of digital solutions within the healthcare value chain and has perpetuated the fragmentation and poor user experience that we see in traditional healthcare. This has resulted in further complexity in deployment, integration, and connectivity of digital solutions, along with high total cost of ownership while slowing down innovation that is needed across the health value chain. As IoT and data volume explodes, we will need not only faster networks, but our ability to aggregate this data and create new insights. These 3 converging megatrends are driving the transformation of healthcare. And P4 healthcare, which was coined by Leroy Hood from Institute of System Biology, is emerging at the intersection of these megatrends. 10 years ago, the proposition that healthcare is evolving from this reactive disease care to care that is predictive, preventive, personalized, and participatory was regarded as highly speculative. Today, the core elements of that vision are widely accepted, and the digital revolution, along with our ability to measure and understand the patient, is enabling the 4 Ps when combined with traditional care. The P4 medicine promises to make care radically more cost-effective by personalizing care to each person's unique biology and by treating the causes rather than the symptoms. It will also provide actionable information to consumers to improve their health as they observe the impact of lifestyle decisions. Working together in digitally powered networks, consumers will be able to reduce the incidence of complex chronic disease that currently account for approximately 75% of healthcare costs in the United States. With these megatrends in mind, I will now focus on 3 key problem areas that are relevant for Samsung Electronics, our partners, and our customers. First is the challenge of improving the experience of care and true engagement and activation. Patient activation refers to the patient's willingness and ability to take steps to manage their own health and healthcare. This involvement can only happen when the patient understands their role in the care process, has the knowledge, the skills, and the confidence to adequately participate in their own healthcare. Given that most of healthcare outcomes of a given patient is due to modifiable behaviors, there is significant interest in understanding how to measure and activate patients. As an example, there's currently a disconnect between wellness and healthcare outcomes. And because of this disconnect, consumers are not able to understand how their behavior impacts their health, nor do they have the actionable insights or the right tools to improve their health status. Moreover, Payers and employers lack the 360-degree view of the patient and thus are not able to effectively allocate their scarce resources to drive the right behavior change that improves outcomes and lowers costs. Second problem is our healthcare spending. U.S. healthcare spending reached approximately $4 trillion in 2020, and by 2028, our spending is expected to reach almost 20% of U.S. GDP. This is despite our robust technology innovation, implying that our novel technologies in isolation are insufficient to bend the healthcare cost curve. Part of the reason is the structural challenges that prevent digital technologies to seamlessly integrate and scale to create significant efficiencies across the value chain. As discussed, the digital revolution in healthcare is furthering the fragmentation seen in our traditional health system, both for healthcare providers and the patients. In fact, the proliferation of siloed healthcare technology has increased the cost due to complexity of integrating digital solutions into other systems and existing workflow. This results not only in higher costs, but also in lower productivity and added challenges with data security and privacy. The last problem I will address is provider satisfaction and productivity in a digital world. Well before the pandemic, many physicians were already facing heavy workloads with too many administrative tasks and wanting more from digital technologies, including electronic health records, that disrupt care processes and workflow. They still wrestle with endless drop-down menus, alerts, regulatory reporting requirements that sap their efficiency and ability to provide a good experience for their patients. There's an opportunity to improve their digital experience by not only unifying but simplifying the multitude of digital solutions that allow them to be more efficient so that they have the time to do what they do best, care for their patients. Today, Samsung is known for innovation of devices that span from smart TVs to wearables. From a go-to-market strategy, we have two broad approaches, a direct-to-consumer and a B2B model. In our direct-to-consumer segment, we have Samsung Health app, along with our wearables that allows our 80 million monthly active users globally to monitor sleep, activity, nutrition, stress, among others. We're also helping consumers to monitor their health with our ECG and blood pressure features in our wearables in over 30 countries to monitor cardiac arrhythmias and high blood pressure. B2B solutions, on the other hand, are partnered-enabled approaches where our devices are bundled as part of a solution and used in the home or hospital setting for various different use cases to deliver user experience and engagement that are customized to a specific setting. Patient engagement examples include Epic MyChart on Samsung tablet in the hospital or clinic, and wearables to measure and nudge patients to stay compliant with exercise or medications. This seamless integration is an example of how our devices empower patients to self-manage and equip hospital staff with the insights to deliver higher quality personalized care. For clinical workflow, we have a ruggedized smartphone device called XCP being used in home healthcare and also in the acute setting with bedside scanning via Epic Rover. We achieve this engagement with our partners in two different ways, a partner-led innovation or co-innovation. Partner-led innovation are where partners are using our devices or data from our devices to develop very specific solutions for various use cases. As an example, Livmore received FDA clearance for the world's first prescription-based wearable for continuous heart monitoring. NIH awarded our partner PhysIQ a contract to develop a wearable AI-based COVID-19 decompensation index biomarker to address the rapid decline of high-risk COVID-19 patients. Other partners leverage our cost-effective devices with Knox capability to deploy and manage their solutions in the field. Medtronic and Dexcom, for example, use our tablets and mobile devices for their FDA-cleared solution as a companion or primary device for their software as a medical device. Co-innovation examples include our partnership with Kaiser Permanente, where we developed a remote cardiac rehab capability using our wearables. With over 10,000 patients, we have shown improvement in compliance to mid-80s compared to 25% with traditional cardiac rehab. While Samsung is a global leader in electronic devices, we believe there's a lot we can do in health and healthcare with our partners. What does our future hold? I will discuss 4 areas: connected user experience, devices and engagement tool, next generation Samsung Health as a digital front door, and data and insights powered by 5G. First, for connected user experience, we will continue to find ways to better connect people, especially those that are aging and socially or geographically isolated. Example is to help millennials as caregivers to easily connect and monitor their aging parents. We will bundle solutions that include fall detections, remote patient monitoring, and social platforms, among others. Samsung Health on smart TVs is an example of our innovation to create a holistic multi-device engagement, which will result in a seamless experience across our smart TVs, tablets, mobiles, and wearables, whether it's to improve a workflow within a clinical setting or to improve the consumer experience in personalized connected fitness. Second, Samsung will continue to take a leadership role in innovation of devices that will become personalized engagement tools that not only display or collect data, but also reduce friction and improve user experience and workflow while lowering total cost of ownership. Our engagement devices will nudge and engage with consumers while improving productivity for care providers who need user-friendly devices that can automate and improve their productivity so they can focus on what they do best. Third, our Samsung Health will be transformed to become the digital front door for health and wellness that quantifies and is personalized and supports navigation to the right resources. Samsung Health app as a digital front door will drive behavior change using our wearables and other devices that measure, monitor, and improve the core pillars of health: activity, stress, nutrition, and sleep. Lastly, we're building a new SDK as an open data platform that will make it easier for our partners to use our devices, especially wearables and healthcare, to create new insights or proprietary algorithms. When data is powered with 5G, which provides low latency and high reliability and security, edge computing is now possible. And we enable innovation in a variety of healthcare use cases to include multidisciplinary virtual care, transferring large terabyte image files in seconds, real-time remote patient monitoring, along with AI, telerobotics, and augmented reality that will all result in better and more efficient care. Now that you've heard what we've been doing and where we're going, I would like to shift the conversation to the how. First and foremost, Samsung will continue our research and development and innovation with devices to meet the needs of healthcare clients, as we've done with our secure ruggedized tablets in the hospitals. We also plan to make our devices more compatible with critical healthcare applications and digital health solutions to increase connectivity, productivity, and to improve the user experience. We'll also support and grow the ecosystem of our partners using our new open SDK platform and tools to make it easier and to improve their speed of innovation that leverage our devices. We've learned a lot from our billions of users and their experiences with our devices and how we can do this better. We will apply what we know about consumers and leverage our learnings into health and healthcare to create a holistic user experience into engagements, and not only within our individual devices, but across our family of devices and other partner devices. I would like to close by sharing with you why we do what we do. First, it's all about connecting people, allowing them to care for each other. Given COVID-induced social distancing, connecting people has become more relevant. And we've been engaged with some of our large health systems leaders who have initiated efforts so that no patients die alone, and to allow a patient to say goodbye with their family members. Our second reason is to improve health of billions. We believe that we will not be able to achieve the 4 Ps of medicine previously discussed if we're not able to address the core pillars of wellness, which includes sleep, nutrition, activity, and stress. Given the global market share of our devices, Samsung is in a very unique position with our partners to leverage our devices to help measure, monitor, and create actionable insights and support to change behaviors that will lead to better health for billions. Lastly, we believe innovation in healthcare is complex, and it's going to take a village. To achieve the vision of healthcare that is predictive, preventative, personalized, and participatory, Samsung will create technologies and platforms that's open and scalable to accelerate innovation. Thank you for your time and attention, and I want to invite other innovators who are interested in transforming healthcare to learn about our current offerings and our future roadmap. We look forward to hearing from you.
Healthcare is rapidly transforming and facing disruptive pressures. In response, industry leaders must leverage innovation ecosystems to remain nimble and drive meaningful change. Ecosystems are where innovation is truly realized. Ideas develop rapidly, talent and funding are available, solutions are quickly prototyped in real-world settings, and partners can bring new innovations to market. If your organization is looking to stay ahead in this constantly evolving environment, 1110 Innovation Partners is ready to drive transformational change with you.
1110 Innovation Partners is a diverse team of industry leaders with deep expertise across healthcare, innovation, strategy, venture, and ecosystem orchestration. 1110's ecosystem powers innovation for a growing group of healthcare and technology Fortune 500s with strategic partners across the entire value chain. Our mission is to create value in healthcare by building a best-in-class ecosystem with the capabilities, assets, and support needed for success. We have all been impacted by the difficulties of navigating the complex healthcare system. This has driven us to create something truly different. At 1110, we leverage our demand-driven innovation process to quickly identify, develop, and validate solutions based on actual end-user needs. Human-centered design is in our DNA, with everything we create being customer-centric and focused on the user experience. 1110's growing innovation ecosystem works with large organizations and startups across technology, health systems, health plans, life sciences, and medical device innovators. Our vision is to continue expanding our ecosystem, spanning across the full continuum of healthcare stakeholders and disruptors. We want to drive tangible outcomes with meaningful value. We welcome your organization to explore and become part of the innovation playground that we've built. We are excited for you to experience how 1 + 1 = 10 with 1110 Innovation Partners.